Upon arrival, you find a 7-year-old boy sitting on a bench, leaning forward in a tripod position. As you approach him, you hear audible expiratory wheezes. Dispatch. You're called to an elementary school playground for a 7-year-old child having difficult breathing.
Okay. So I'm wearing proper PPE. Is my scene safe?
Yes.
Okay. Nature of illness is something respiratory. I have one patient. I would go ahead and call ALS, and I would not do anything with C-spine. My general impression is I have a young boy sitting in the tripod position having a hard time breathing. What is his level of consciousness?
Responsive but anxious.
Okay. And chief complaint is difficulty breathing. Anything else?
No.
Okay. So airway and breathing.
Currently open, audible, expiratory, wheezing heard.
Okay. What is his is his chest rise and fall equal?
It's rapid and shallow, symmetrical rise and fall in the chest, and his nasal is flaring and using accessory muscles.
Okay. What is respiration rate?
87%.
That's the amount of times that he's breathing. It's under baseline.
48 beats per minute.
Okay. And what is, so SpO2 is 87?
Yes.
Okay. What is, what's the lung sounds?
Wheezes in the upper lobes, little air movement in the lower lobes.
Okay. And then, with being at 87%, I would want to initiate high flow oxygen via non-rebreather at 15%, or oh my gosh, 15 liters per minute. I think that is everything for airway breathing. So circulation, what is the pulse?
152 beats a minute.
Okay. And what is skin color?
Pale, cool, and moist.
Okay. And is there any bleeding anywhere?
None.
Okay. So that's all for circulation, I think.
Radial pulse fast, strong, and equal.
Okay. So he's a rapid transport, high priority. Everything kind of sounds like an asthma ordeal. Does he have an inhaler at the school?
Located in his backpack in the classroom.
Okay, so I would have my partner be escorted to go and get the inhaler from the classroom, and I would start getting ready for transport. I would contact medical direction and see if they want me to use a nebulizer or if they want me to administer the inhaler or help him in administering it because I can't give it to him myself. So before I give him the inhaler, well, let's just say my partner's back, we're moving. So I want to do baseline vitals real quick so I can give him the inhaler. What's the blood pressure?
96/62.
Okay, respiration is 48, pulse is 152, and SpO2 is still 87, it says, right?
On room air, yes.
Okay. And then, so I would go ahead and help him with the inhaler, giving clear instructions. Well, also, what does pupils look like?
Pearl.
Okay. So we give him the inhaler, and then I'll do my history. So we'll do, I think OPQRST comes first, I think. What's the onset?
Approximately 15 minutes prior to arrival.
Provocation.
Running on playground with classmates.
Quality.
Shallow respiration, no pain.
No pain means no radiation. Yeah.
Correct.
Severity
Severe respiratory distress,
and time.
15 minutes.
Okay. Sample, signs and symptoms.
Lungs, exploratory wheezes, audible, and osculated in upper lungs, little air movement in the lower lobes. You notice nasal flaring and use of accessory muscles.
Okay. Allergies,
It does not say.
medications,
Amoxicillin.
pertinent medical history,
He has asthma.
and last oral intake,
Lunch.
events leading up to.
Playing on the playground with his friends.
Okay. So now I want to assess that affected area, and that would be the pulmonary system. So then we'll go ahead and recheck his vitals. What's the lung sounds after I gave him the inhaler?
42 beats a minute.
Okay, so it slowed down a little bit. What is SpO2?
92% on. 100% oxygen.
Okay. Respiration rate? Oh, we just did that, sorry. Blood pressure?
100/68.
Okay. And then pupils?
It does not say.
Okay. Does his skin look any different?
It does not say.
Okay. What's his quality of the respirations? Does it say under repeat? Like equal chest rise fall? Is it adequate?
No.
It does not say? Or no, it's not adequate?
There's slight improvement in the patient's condition after administration of inhaler.
Okay. So my field impression is an asthma attack. The interventions was we gave him the inhaler, and we're transporting him to the emergency room. We would reassess every 5 minutes, and then whenever we get to trade him off to either ALS or the emergency room, is I would say that there was a young boy sitting tripod position, difficult time breathing. The initial respiration rate was 48, SpO2 87, pulse 152. We administered an inhaler, 2 puffs. Blood pressure was also 96/62. And after redoing the vitals, it brought blood pressure to 100/68, SpO2 92%, and the respirations went down to 42.